The Committee on Health, Education, Labor, and Pensions will come to order. Today we're reviewing the nomination of Dr. Tom Price to be the Secretary of Health and Human Services. Dr. Price, we welcome you and congratulations on your nomination. Welcome to you and your wife, Betty, who is here today with you, and I enjoyed having the opportunity to visit with you in my office and to learn from you about your plans. Dr. Price will be introduced today in a few minutes by Johnny Isakson, a member of this committee and Dr. Price's home state senator. Before Senator Isakson introduces the nominee, Senator Murray and I will each make a few introductory remarks. After the nominee makes his statement, we'll have the usual round of questions. Now, let me say something about the round of questions. Last night, we had a hearing of 3.5 hours. I had tried, as chairman, to be fair by following the same precedent we had for President Obama's 2 education nominees by having one round of 5-minute questions followed by Senator Murray and me asking questions and wrapping up. I don't want to re-argue that because we spent a lot of that 3.5 hours arguing about the 3.5 hours. I've listened carefully to what my colleagues have said, and I looked back at the precedent for the Health and Human Service Secretary when that person came before our committee. Secretary Burwell had one round of questions. Sebelius, 1 round plus Coburn. Dr. Coburn asked a question. Daschle, 1 round plus 3 senators asked a question. Leavitt, 6 members asked questions in the second round. Thompson, 1 round, but it was a round of 7 minutes. Shalala, 6 members asked a second round. So what I've decided to do is, in an effort to try to treat President-elect Trump's nominee approximately the same as the way we've treated other nominees, is to have a single round of 7-minute questions today. That would be the precedent followed with Secretary Thompson, and that seems to me to give every member of the Senate more time to ask questions of the Secretary. This is a courtesy hearing. Dr. Price will be before the Finance Committee on next Tuesday. A number of the members of this committee are also members of the Finance Committee. We don't vote on his nomination. They vote on his nomination and will be the ones that report it to the floor if that's their decision. We have the hearing because we have some of the healthcare jurisdiction, some important parts of it, and we would like to talk to him about especially those issues. He has all of his paperwork in place before the Finance Committee, including the letter of agreement with the Office of Government Ethics, which is on the website and available to members of this committee as well as others. And so it's my hope would be that in our 7 minutes of questions that we'd have time to focus on the responsibilities of the Department of Health and Human Services rather than have a continuing discussion about the number of minutes. There'll be an opportunity following the hearing to ask written questions of Dr. Price as well. Dr. Price, if you're confirmed to lead the Department of Health and Human Services, you'll be running an organization that spends $1.1 trillion a year. It's always troubled me, actually, that you'll be in charge of spending more than the Congress actually appropriates every year. By that I mean the part of the budget that we appropriate and which is under pretty good control, which is the part that has national defense and national institutes of health and national parks and national laboratories. Over the last several years and for the next several years, that part is rising at about the rate of inflation. It's not adding to the budget. It's about 1/3 of the total amount of federal government spending. But it's a little less than the amount that's in your department every year, most of which is entitlement spending, mandatory spending, and which is going up at a rate like that while the rest of the budget is going like this. You'll be overseeing Medicare and Medicaid, mental and substance abuse programs. We just enacted in December of last year, and the President signed the most important reforms of those programs in a decade. Senator Cassidy and Senator Murphy were the leaders on that in this committee, along with Senator Murray. The Food and Drug Administration, we made important changes in the Food and Drug Administration, giving them new authority and new responsibility. For example, new authority to hire and pay the experts they need to move products and devices through the FDA at a more rapid rate, saving time and money and getting those devices into the medicine cabinets and the doctor's offices. That was Dr. Califf's #1 priority. We passed that into law in December. And then the implementation of Obamacare and the various proposals to repair the damage done by Obamacare and replace it with concrete, practical alternatives for the American people that give them more choices of lower-cost health insurance. Dr. Price, I believe you're an excellent nominee for this job. You were a practicing orthopedic surgeon for nearly 2 decades. You were a professor at Emory University School of Medicine. I read about the resident doctors in training who you taught. You served as medical director of the orthopedic clinic at Grady Memorial Hospital. In the House, you were chairman of the Budget Committee, and you've been a leader in deliberations over the future of our health care system. So you know the subject very, very well. One of the first responsibilities that you will have is to give us your advice about how to repair the damage that the Affordable Care Act has caused to so many Americans, and how to replace it, or to replace parts of it, with concrete, practical alternatives that give Americans more choices of lower-cost insurance. Let me give my view about how we might proceed on that, and then during the question and answer session, I will ask you more about your view. Following the presidential election, President-elect Trump said on 60 Minutes that replacement and repeal of Obamacare would be done simultaneously, his word. To me, that means at the same time. And then recently, Speaker of the House Paul Ryan said that repeal and replacement of Obamacare would be done concurrently. And then Senator McConnell said last week that we need to do this promptly, but in, quote, manageable pieces. Trying to interpret what those words mean, to me that means Obamacare should be finally repealed only when there are concrete, practical reforms in place that give Americans access to truly affordable health care. The American people deserve health care reform that's done in the right way, for the right reasons, in the right amount of time. It's not about developing a quick fix. It's about working toward long-term solutions that work for everyone. One way to think about what simultaneously and concurrently mean is to think about Obamacare in the same way you'd think about a collapsing bridge in your hometown, because that's just what's happening with Obamacare in my home state and in many other states. According to the Tennessee Insurance Commissioner, the Obamacare insurance market in our state is, quote, very near collapse. And across the country, premiums and copays are up. Employers have cut jobs in order to be able to afford the mandates of Obamacare. Medicaid mandates are consuming state budgets. In 1/3 of America's counties, citizens with federal subsidies have only a single choice of company to buy insurance from on the Obamacare exchanges. Without quick action next year, there may be zero choices on those exchanges. Their subsidies may be worth as much as a bus ticket in a town where no buses run. If your local bridge in Georgia or in Tennessee were very near collapse, the first thing you'd do, I would think, is to send in a rescue crew to repair the bridge temporarily so no one else is hurt. Then you would build a better bridge, or more accurately, in the case of health care, many bridges to replace the old bridge. And finally, when the new bridges are finished, you would close the old bridge. That's how I suggest we proceed. Rescue those trapped in a collapsing system. Replace that system with functional markets, as states develop their own plans for providing access to truly affordable health care, and then repeal Obamacare for good. First, we should offer a rescue plan so the 11 million Americans who buy individual insurance now in the exchange can continue to do so while we build a better set of concrete, practical alternatives. Second, we should build better systems, providing Americans with more choices of insurance that cost less. Note that I say systems, not one system. If anyone is expecting Senator McConnell to roll a wheelbarrow onto the Senate floor with a 4,000-page comprehensive Republican health care plan, they're going to be waiting a long time because we don't believe in that. We don't want to replace a failed Washington, D.C. healthcare system with another failed Washington, D.C. healthcare system. So we'll build better systems, providing America with more choices of insurances and that cost less, and we'll do this by moving more healthcare decisions out of Washington, D.C. and into the hands of states and patients, and by reducing harmful taxes. And we'll do this carefully, step by step, so that it's effective. Finally, we should then repeal what remains of the law that did the damage and created all this risk. I know that the President-elect has said that after you are confirmed, which is, I hope, is fairly early in February, that he will propose a plan to Congress. I look forward to that plan, and I know you can't tell us what that plan is today, but I do look forward to hearing from you how you suggest we approach this. We want to do this right. We want to sequence the events carefully and adequately so that Americans have concrete, practical alternatives in place of what is there today. And we want to make sure that the parts of Obamacare that are repealed are replaced before the repeal becomes effective. Senator Murray.
Thank you very much, Chairman Alexander. Thanks to all of our colleagues that are joining us today. Congressman Price, congratulations on your nomination, and thank you to your wife, Betty, who I know is here with you. You're well. But before I speak about this nominee, I do want to say that we remain deeply disappointed in last night where Democrats were blocked from asking more than one round of questions on Betsy DeVos, who's the nominee for Secretary of Education, and are disappointed that we are rushing this hearing as well. Mr. Chairman, you said 7 minutes, but I will just say I don't think any of us in prior nominees that you keep pointing to ever thought if I don't ask for another question, I have just set a precedent. In fact, I think that there is no example of any senator asking to do a question before and being turned down. So these nominees in a new administration that many people have questions about deserve to be asked questions, scrutinized in public before we have a choice to make on the floor of the United States Senate on both sides of the aisle in terms of whether we vote yes or no. That is why we think it's extremely important that we are allowed the opportunity to ask second rounds of questions after we have heard all of the questions. And today we have 3 or 4 committee hearings going on at the same time as this, so it is extremely challenging for our senators to be here on a nomination they care deeply about, on a subject that we care deeply about. So I would just like to point out again that several nominees that have come before, if we're going to talk about President, Secretary Leavitt, President George Bush's second HHS Secretary, 5 bipartisan senators participated in a second round. Senator Daschle, President nominees, Obama's first HHS Secretary, 3 bipartisan senators participated. And again, it is unprecedented for a chairman to turn down a member who has a question to ask. So for the record, I would just like to ask consent to put parts of the record of the nominees of Michael Leavitt, Andrew Van Oschenbeck, and Tom Daschle into the record of this hearing.
Oh, that'll be fine.
And again, our members have questions because this nominee is going to have jurisdiction over the health care and lives of millions of Americans, and we want to know where he stands before we make a decision, yes or no, on our imprimatur to him to be there. So that is why it is so important to members of our community. Now, having said that, I want to say this. The health of our families and communities could not be more important to our strength as a nation. When a young child goes to school healthy and ready to learn, she's better prepared to succeed. When women are empowered to plan their families and pursue all of their dreams, our communities benefit. When workers have access to quality health care that they can afford, our economy grows. And when seniors are able to trust that the guarantee of programs they have paid into, Medicare and Social Security, will be there when needed, we live up to some of our country's most vital responsibilities. The Department of Health and Human Services has a critical role to play in our ongoing work to meet each of these goals and many more. That is why in evaluating a nominee for Secretary of Health and Human Services, I consider whether the nominee has a record of putting people first, not politics, not partisanship, or those at the top, whether they will put science first, not ideology, and whether their vision for our health care in our country would help more families get quality, affordable care or take us backward. Congressman Price, I have serious concerns about your qualifications and plans for the department you hope to lead, and I'm looking forward to hearing from you today on a number of topics. I'll start by laying out issues with what your record suggests about your approach to our nation's healthcare system. Just last week, you voted to begin the process of ripping apart our healthcare system without any plan to replace it, despite independent studies showing that nearly 30 million people would lose health care coverage. Even though more and more members of your own party are expressing serious doubts about its ability to unify around a plan, and knowing that in a matter of weeks you could be leading the department whose core responsibility is to enhance America's health and well-being. My constituents are coming up to me with tears in their eyes, wondering what the future holds for their health care given the chaos Republican efforts could cause. President-elect Trump and Republican leaders have promised the American people their plans to dismantle our health care system right away would somehow do no harm and would not cause anyone to lose coverage. In fact, just days ago, President-elect Trump promised, quote, insurance for everybody. But Congressman Price, your own proposals would cause millions of people to lose coverage, force many people to pay more for their care, and leave people with pre-existing conditions vulnerable to insurance companies rejecting them or charging them more. So I will be very interested in hearing your explanation of how you have your plans to how we would keep the promises your party has made to the American people about their health care. Medicare is another issue I will be interested in hearing about today. President-elect Trump campaigned on promises to protect Medicare and Medicaid. You have said you plan to overhaul Medicare in the first 6 to 8 months of this administration in a way that would end the guarantee of full coverage that so many seniors and people with disabilities rely on. You have put forward policies that would shift $1 trillion in Medicaid costs to our states, squeezing their budgets and taking coverage away from struggling children and workers and families. And while President-elect Trump has said that Medicare should be able to negotiate lower drug prices for seniors, you have repeatedly opposed efforts to do that. You even went so far as to call legislation on that issue a solution in search of a problem. I disagree. This is absolutely critical for families in my home state, and I'm eager to hear how you would reduce the burden of prescription drug costs in our communities. As a woman, as a mother, and a grandmother, and a United States Senator, I am deeply troubled by the ways in which your policies would impact women's access to health care and their reproductive rights. I have serious concerns about your understanding of women's needs for basic health care like birth control, given your expressed doubts on this topic, your proposals to make women pay extra out of pocket for birth control, and your repeated efforts to defund our nation's largest provider of women's health care, Planned Parenthood. And I'm also very focused on the role of the Department of Health and Human Services in strengthening and protecting public health. So I want to hear from you about whether and how you would uphold the gold standard of FDA approval and, for example, how you would approach important programs and rules intended to keep tobacco companies from luring children into addiction. Finally, as I discussed at our hearing yesterday, I believe firmly that especially as the President-elect tries to blur lines around conflicts of interest, it is critical we not only do everything in our power to hold him to high standards, but we do the same for cabinet nominees. That's why I was so appalled that with 4 of the President-elect's nominees currently serving in the House of Representatives, House Republicans attempted right out of the gate to get rid of the independent Office of Congressional Ethics. Now, luckily, they heard loud and clear from people across the country it wasn't acceptable, and they backed down. Congressman Price, the Office of Congressional Ethics has now been asked not only by Democrats, but by consumer advocacy group Public Citizen to investigate serious concerns and questions about your medical stock trades during your time in the House. I and other Democrats have repeatedly called for hearings on your nomination to be delayed until such an investigation is complete. It is disappointing to us that instead Republicans are moving forward with your nomination before we have all the facts. I hope you've come prepared to be fully transparent with us in your explanation. So I've outlined just a few of my questions and concerns about this nomination, and I know in light of Republican efforts to take our healthcare system in a vastly different and harmful direction that are shared by millions of people across the country who can't be here today. With that in mind, it's crucial that the voices of people who will be impacted every day by choices made under this administration are part of the process when it comes to the President-elect's cabinet nominees. So I just want to say I'm very pleased that tomorrow Senators Warren and Stabenow will be hosting a forum with witnesses who can speak to the impact of healthcare providers like Planned Parenthood, the importance of the work done in the Affordable Care Act to expand access to mental health care and substance abuse treatment, and the ways in which the full guarantee of Medicare has helped keep them financially and physically secure. There are stories across the country like this of lives saved and strengthened because of the progress we've made to expand quality, affordable health care. I urge my Republican colleagues to attend and to prioritize what is best for these women and men and families, not what's best for politics, as they consider each of the decisions in the coming weeks. Congressman Price, as we begin this hearing, I would ask you to be as transparent and frank as possible about your views and your plans for the department, and urge you to commit to providing us with additional information and answers to any follow-up questions we have in a timely and thorough manner. I'm looking forward to what I hope will be a rigorous and open discussion today, and I hope that we all arrive at the right decision for the families and the communities that we serve. Thank you, Mr. Chairman.
Thank you, Senator Murray. Before I introduce Senator Isaacson, I'd like to put in the record the information about the last 6 hearings that we've had here without going into detail. The current secretary, 1 round of questions. Secretary Sebelius, 1 round with 1 member asking a 2nd round. Daschle, 1 round plus 3. Levitt, 6 members ask a 2nd round. Thompson, 1 round of 7 minutes each. Salelas, 6 members ask a 2nd round. So my decision is that rather than give 6 of 23 members a 2nd round, that it would be better to let every senator have 7 minutes. Now, Senator Isaacson.
Thank you, Mr. Chairman. I'd like to ask unanimous consent that the remarks that were prepared for me to read this morning be submitted for the record.
They will be.
Because I'm not going to read them. I have a unique honor and privilege to introduce a friend of mine for 30 years, someone I know to be a great politician, a great practicing legislator, a great family man, a great community servant, and a great friend of mine. It's an honor for me to do so. And I want to thank each of you for taking my call before this meeting today when I called you to ask you to listen to what Tom had to say, because I think you'll be impressed with what you hear, no matter how tough the question might be. You know, I approach this introduction as if I'm being asked what I would look for in somebody who I wanted to entrust with $1 trillion of my money, the quality of my health care, and the future of the American quality of health care. And I'd look for 5 things. First, does this man understand the American family? Not only does he understand it, but his wife, Betty, is here. Betty, stand up. She'll tell you he understands the family. And his son, Robert's not here because he's in Nashville, Tennessee, singing country music and writing country music songs, which I know the chairman would appreciate. And he's a fine young man, and I enjoy working with him. Tom is a great family man, member of Roswell United Methodist Church, active in his community, active in the state legislature, active in doing what's right for his community. He's a good man and understands the family and the value of the family and the value of health care to every family. Second thing I'd want to know, is he capable of handling $1 trillion? You know, $1 trillion is a lot of money. It's actually 1.1 trillion, but when you get to 1.1, why worry about it? It's a lot of money. It's more than we appropriate, as the chairman said. He's been chairman of the Budget Committee in the House of Representatives. He served in the Georgia legislature, leading appropriations for many, many years. He's run one of the largest medical practices in the state of Georgia. In fact, Tom Price is one of those people that put together what's known as Resurgence Orthopedics. They happen to be my doctors. In fact, they saved my son's right leg 26 years ago in a terrible automobile accident. I understand the value of Resurgence Orthopedics and what Tom has done. It's now the largest practice in our state, a well-run practice, and a practice that's set up as an example of how to do medicine in the 21st century. I want to know that my nominee for Health and Human Services understood the healthcare business. Well, who better to understand the healthcare business than a doctor? Even better than that, a doctor who's married to another doctor. Tom and Betty met at Grady Memorial Hospital when they were doing their residencies. They fell in love there, and they fell in love with the practice of medicine. And I've watched them over the last 30 years participate in activities in our state, whether elected or not, that contributed to the betterment of health care in our state, the betterment in hospitals like Grady Memorial Hospital, which is the largest crisis hospital and trauma center we have in the state of Georgia, saving lives every single day, that would have probably not been there today had it not been for people like Tom Price, who gave of his time and his effort to see to it we raised the money necessary to keep Grady open. I'd want to know they had some experience with the legislature, because, you know, if you get a chairman of Health and Human Services to come in, you give them a $1.1 trillion budget and then say, go talk to this 435 people over there and convince them of what we need to do to change the law. That's a pretty tall order. You'd want to find somebody who's served in public office. Tom's been in the State Senate of Georgia, was the first elected Republican leader of the Georgia State Senate in the history of our state. He served in the Congress of the United States. In fact, he improved the 6th District remarkably when I left and he was elected to replace me. The intellectual level went way up when Tom came, I can promise you that. And he's done an outstanding job being reelected 6 times to the United States House of Representatives, serving, as I said, as budget chairman, as study committee chairman, and as a very active member of the Congress of the United States of America. I'd want to also know if he was an accountable person and believed in accountability. Tom Price believes in accountability. He's one of the rare one of us. In fact, he may be the only one of us, and I know this is true, that reads all the bills. In fact, when I need to know something about a bill, rather than read, I call Tom Price to give me advice because I know he's read it. Sometimes he's boring, but he's always knowledgeable. And it's because he does his homework, he does it right, he believes in his responsibility. Now, I'm going to mention a couple of things that have been said negative about Tom, and I want to address them straight up because they're wrong. In fact, I did on the floor of the Senate yesterday afternoon when Chuck Schumer took this case of Zimmer Biomet and tried to make it into a major case. Zimmer Biomet is a 26-share stock that Tom Price's broker who manages his account bought for him at a time Tom was unaware of the purchase. It was 2 months after the House had acted on a medical device bill. There's a term of art called desperate impact, where you take 2 facts that are unrelated and you put them together to indict somebody for a wrong, when in fact nothing wrong was done at all, and that's the case there. The Zimmer Biomet, a $2,674 stock purchase, took place without Tom's knowledge because his account is managed by someone else. His knowledge of that purchase took place 1 month later after the disclosure was made. He didn't even know about it at the time that it was made. So the allegations that were made yesterday on the floor of the Senate are patently wrong by taking 2 correct things, putting together to make an incorrect thing. Now, second, something else has been said that I have working knowledge of. Tom was accused of not being for saving Social Security for seniors. Now, I'm 72 years old. I ain't going to stand up here and try to get y'all to prove somebody's not going to protect Social Security, because I got some of it. But let me tell you a little story about Tom Price. He and I got a phone call 6 months ago, I guess now it's been 8 months ago, from AARP, asking us if we would travel and do town hall forums for AARP on saving Social Security. Now, why would somebody call Tom Price, a congressman, or Johnny Isaacson, a senator, to be the organization that represents seniors, to go on the road and do town hall meetings about saving Social Security if they weren't for saving Social Security? It's just incongruent, and it doesn't make any sense. Lastly, one of the best votes I cast 4 years ago for cabinet members was a vote for Sylvia Burwell. When she came before this committee and the House and the Senate Committee on Finance, I was on both committees as I am today. She's an articulate, intelligent lady. There was a lot of reason for me as a Republican in the minority to say, oh, I'll just throw a throwaway vote and I'll vote against her because she's a Democratic nominee. But I listened to her answers, I studied her history, I watched her actions, and I proudly voted for her. And today she's a professional friend of mine, and we'll miss her in her office. But there's nobody better qualified to replace Sylvia Burwell than Tom Price. I voted for Sylvia Burwell with pride, and I'm going to vote with Tom Price with pride, because I know he's the right man for the right job at the right time for America. He's my friend, and I commend him to you, and I urge you to vote for him in his confirmation.
Thank you, Johnny. God bless you.
Thank you, Senator Isaacson. That's much better than whatever was written for you to say. Dr. Price, welcome to the committee.
Thank you, Mr. Chairman. Chairman Alexander, Ranking Member Murray, and all the members of the committee, I want to thank you all for the opportunity to speak with you today and engage in, as the Ranking Member said, in a discussion about the road ahead for our great nation. I want to thank Senator Johnny Isaacson for his generous introduction. As he said, we've known each other for 30 years, and I'm so grateful for his friendship and his kindness. And our state is blessed to have had his service and his leadership. I wish also to especially thank my wife, Betty, of 33 years, who joins me here today. As Johnny mentioned, her support and encouragement and advice, which I would suggest to you is virtually always correct, and her love means more to me than I could ever say. Over the past few weeks, I've met with many of you individually and have gained a real appreciation for the passion that you have for the Department of Health and Human Services. Please know that I share that passion. That's why I'm here today and why I'm honored to be the nominee for Secretary of Health and Human Services. We all come to public service in our own unique ways that inform who we are and why we serve. My first professional calling was to care for patients. That experience as a physician and later as a legislator has provided a holistic view of the complex interactions that take place every day across our communities. And today I hope to share with you how my experience has helped shape me and my understanding and appreciation for the work of the Department of Health and Human Services. From an early age, I had an interest in medicine. My earliest memories are of growing up on a farm in the state of Michigan. We lived on a farm in Michigan before we moved to suburban Detroit when I was 5 years old. I spent most of my formative years being raised by a single mom. Some of my fondest memories are spending time with my grandfather, who was a physician. When I was young, I would be able to go on, spend some weekends with him, and we'd go on rounds, which at that time meant going on house calls. And so we'd drive up to houses, and the memories that I have of individuals opening the door and giving him a hug and welcoming him graciously are cemented in my mind. After graduating from medical school from the University of Michigan, I moved to Atlanta, which I've called home for nearly 40 years. It's where I met my wife, where we raised our son. I did my residency at Emory University and Grady Memorial Hospital, where I would later return in my career to serve as the medical director of the orthopedic clinic. Throughout my professional career, I've treated patients in all walks of life, including so many children. And anyone who's ever treated a child knows the remarkable joy that you have when you're able to go tell the mom and dad that we have helped. We've helped save an individual, save their child, or help their child back to healthfulness. My memories of Grady are filled with the gracious comments of parents and of patients for the team of healthcare specialists with whom I had the privilege of working. After 25 years of school and training, I started a solo orthopedic practice. Over the years, this practice grew, as Senator Isaacson mentioned, and eventually became one of the largest non-academic orthopedic groups in the country, for which I would eventually serve as chairman of the board. During 20 years as a practicing physician, I've learned a good bit about not just treating patients, but about the broader healthcare system and where it intersects with government. A couple of vivid memories stand out. One, many of my patients were never more irritated or angry when they recognized that there was somebody else in the exam room, not physically, but figuratively, who was getting between the doctor and the patient in making decisions, whether it was the insurance company or government. And then there was the day when I noticed in my office, it was in the mid-90s, when I realized that there were more individuals behind the door where the clinical work was going on seeing patients than there were in front of the door, and those folks were filling out forms and making certain that we were checking all the boxes and either challenging or arguing with insurance companies or government about what was in the best interest of the patient. And it became clear to me that our healthcare system was losing focus on its #1 priority, and that is the patient. As a result, I felt compelled to broaden my role in public service and help solve the issues harming the delivery of medicine, and so I ran for the Georgia State Senate. I found the State Senate in Georgia to be often remarkably bipartisan and that collegial relationships were the norm. This is the environment in which I learned to legislate, reaching across the aisle to get work done. In Congress, I've been fortunate as well to be part of collaborations that broke through party lines to solve problems. Just this past Congress, it was a bipartisan effort that succeeded in ridding Medicare of a broken physician payment system, and which has now begun the creation of a new system which, if implemented properly, will help ensure that seniors have better access to higher quality care. So if confirmed, my obligation will be to carry to the Department of Health and Human Services both an appreciation for bipartisan team-driven policymaking and what has been a lifetime commitment to improving the health and well-being of the American people. That commitment extends to what I call the 6 principles of health care: affordability, accessibility, quality, responsiveness, innovation, and choices. But Health and Human Services is more than health care. There are real heroes at this department doing incredible work to keep our food safe, to develop new drugs and treatment options, driven by scientists conducting truly remarkable research. There are heroes among the talented, dedicated men and women working to provide critical social services, helping families, and particularly children, have a higher quality of living and the opportunity to rise up and achieve their American dream. The role of Health and Human Services in improving lives means it must carry out its responsibilities with compassion. It also must be efficient and effective and accountable, as well as willing to work with those in communities already doing incredible work on behalf of their citizens. Across the spectrum of issues and services that this department handles, there endures a promise that has been made to the American people. We must strengthen our resolve to keep the promises our society has made to our senior citizens and to those who are most in need of care and support. That means saving and strengthening and securing Medicare for today's beneficiaries and future generations. It means ensuring that our nation's Medicaid population has access to the highest quality care. It means maintaining and expanding America's leading role in medical innovation and the treatment and eradication of disease. I share your passion for these issues, having spent my life in service to them. And yet there's no doubt that we don't all agree on or share the same point of view when it comes to addressing every one of these issues. Our approaches to policies may differ, but surely there exists a common commitment to public service and to compassion for those that we serve. We all hope that we can help improve the lives of the American people, to help heal individuals and whole communities. So with a healthy dose of humility and an appreciation for the scope of the challenges before us, with your assistance and with God's will, we can make it happen. And I look forward to working with you to do just that. Mr. Chairman, I thank you for the opportunity to be with you today.
Thank you, Dr. Price. And we'll now begin a round of 7-minute questions, and I'll start the questioning. I'd like to talk about the Affordable Care Act and the health care system. My belief is that the historic mistake in passage of the Affordable Care Act was it sought to expand a system that already cost too much, a health care system. What is our goal here of those who want to repair the damage of Obamacare and replace parts of it? Is it to lower the cost of insurance for Americans? Is it to give them more choices of that lower cost insurance? And is it to put more decisions in the hands of states and into the hands of patients?
Yeah, thank you, Mr. Chairman. I think certainly the issues that you raise with choices and access and cost are at the heart and the center of where we ought to be putting our attention. As I mentioned in the 6 principles that I have for health care, affordability is incredibly important. It doesn't do you any good if you can't afford health coverage. Accessibility is absolutely imperative. If you have, today many folks have coverage, but they don't have care because they don't have access to the physicians that they'd like to see. So choices are absolutely vital.
Well, isn't one of the primary means for achieving those choices moving more health care decisions out of Washington, putting them back in the hands of states and patient consumers?
I think in many instances, the closer that you can have those decisions to the patient, keeping your focus on the patient, the better.
And if the responsibilities are headed toward the states, or some responsibilities, would that not necessarily involve a fair amount of extensive consultation with governors and state insurance departments about how to do that and what the implementation schedule ought to be?
Absolutely. Folks at the state level, as you well know, having served there, know their populations better than we can know them.
Senator McConnell said last week that Obamacare would be replaced and repealed in manageable pieces. I want to suggest some pieces to you on a chart back here. There looks to me like there are four major areas where Americans get our health care insurance. One is Medicare, 18% of Americans. One is employer insurance, 61% of Americans get their insurance on the job. One's Medicaid, and one is, which is 22%, and one is the individual market, only 6%, and the exchanges we hear so much about are just 4% of that 6%, but that's where so much of the turmoil is. Let me ask you this, is this the bill, any effort to replace and repeal Obamacare, is this the bill to reform Medicare?
Absolutely not.
So we would be focused on employer, Medicaid, and individual insurance. Are those accurate categories, or would you categorize them in a different way?
I think the challenges that we have to address immediately are those in the individual market and in the Medicaid market, as you identified.
Mm-hmm. And is it possible to work on one of those areas at a time, rather than in a comprehensive, or let me put it this way, I said that don't expect Senator McConnell to wheel in a wheelbarrow with a big comprehensive Republican health care plan. That's because, in my opinion, we don't believe in that. We don't believe in replacing a failed Washington, D.C. health care plan with our own failed plan. We want to work on it step by step, large piece by piece. Is that how do you respond to that?
I think that's fair. I think that for individuals the American people need to appreciate that the last thing we want to do is go from a Democrat health care system to a Republican health care system. Our goal would be to go from what we see as a Democrat health care system to an American health care system that recognizes the needs of all.
Now, I know your plan won't be presented until after you're confirmed, but the president-elect has said, let's do repeal and replace simultaneously. To me, that must mean that any repeal of parts of Obamacare wouldn't take effect until after some concrete, practical alternative were in place for Americans to choose. Is that accurate, or do you have a different idea of what simultaneous might mean, or what the sequencing might be as we move through this process?
No, I think that's fair. I think one of the important things that we need to convey to the American people is that nobody's interested in pulling the rug out from under anybody. We believe that it's absolutely imperative that individuals that have health coverage be able to keep health coverage and move, hopefully, to greater choices and opportunities for them to gain the kind of coverage that they want for themselves and for their families. So I think there's been a lot of talk about individuals losing health coverage. That is not our goal, nor is it our desire, nor is it our plan.
Let me ask you about how long this might all take, this repairing the damage, this working on these three big areas, individual market, Medicaid, and employer. My sense of it is that we've been working on this so long, although we have different opinions about it, we ought to be able to make most of our votes in the next few months about what to do, but that the implementation of whatever we decide, especially since it will be going, some of it back to the states, to the department that you hope to lead, might take several years. Is there a difference between the votes we might take and then a longer time for implementation of what we decide to do?
No, I think that's fair. I would point out that our health care system is continually evolving and should. We ought to be always looking at how it's working, whether it's working for patients, whether it's working for the individuals that are working to provide the highest quality care for folks. And when it is, that's fine. When it isn't, then it's incumbent upon policymakers to make certain that we do the kinds of things to adjust that policy so that it can work, especially for patients.
My last question is about this individual market, the 6%. The Obamacare exchanges are about 4% of all of us who have insurance. Our insurance commissioner in Tennessee says the market is virtually collapsing. I'm told by many people that we need to basically have a rescue plan, a reform plan for the individual market in place by March the 1st, so that insurance companies who make their decisions about the year 2018 can make those plans so that people have insurance to buy in all of these states. Do you agree that the market is collapsing, that we need a rescue plan, and that March the 1st is an important approximate date for a decision of action?
Well, we're clearly seeing changes in the individual and small group market that are adverse to the patient, whether it's decreasing access to coverage, whether it's increasing premiums, whether it's higher deductibles. Something is going badly wrong out there, and it's imperative, I believe, for us to recognize that and then to put in place the kinds of solutions that we believe to be most appropriate.
And your plan that we're likely to see in February will include recommendations for how to do that?
We look forward to, should I be given the honor of leading it, Health and Human Services, along with the President, we look forward to working with Congress to come forward with that plan.
Thank you, Dr. Price. Senator Murray.
Thank you, Mr. Chairman. Before I start, I want to ask consent to put a letter to Chairman Alexander from all 11 Democrats on this committee on the importance of a second round of questions on this nominee. And I ask unanimous consent to put in the record 25 letters signed by 193 organizations opposing Congressman Price's nomination to lead the Department of Health and Human Services. And I also have a petition signed by 500,000 people from across the country opposing this nomination. I ask to put in the record.
They will be.
Congressman Price, recent press reports about your investments in the Australian biotech company Innate Immunotherapeutics raises some serious questions about your judgment, and I want to review the facts. You purchased stock in Innate Immunotherapeutics, a company working to develop new drugs, on 4 separate occasions between January 2015 and August 2016. You made the decision to purchase that stock, not a broker, yes or no?
That was a decision that I made, yes.
You were offered an opportunity to purchase stock at a lower price than was available to the general public, yes or no?
The initial purchase in January of 2015 was at the market price. The secondary purchase in June through August, September of 2016 was at a price that was available to individuals who were participating in a private placement offering.
That was lower than was available to the general public, correct?
I don't know that it was. It was the same price that everybody paid for the private placement offering.
Well, Congressman Chris Collins, who sits on President-elect Trump's transition team, is both an investor and a board member of the company. He was reportedly overheard just last week off the House floor bragging about how he had made people millionaires from a stock tip. Congressman Price, in our meeting, you informed me that you made these purchases based on conversations with Representative Collins. Is that correct?
No,
that is what you said to me in my office.
What I believe I said to you was that I learned of the company from Congressman Collins.
What I recall our conversation was that you had a conversation with Collins and then decided to purchase the stock.
No, that's not correct.
Well, that is what I remember you hearing it say in my office. In that conversation, did Representative Collins tell you anything that could be considered, quote, a stock tip, yes or no?
I don't believe so, no.
Well, if you're telling me he gave you information about a company, you were offered shares in the company at prices not available to the public, you bought those shares, is that not a stock tip?
Well, that's not what happened. What happened was that he mentioned, he talked about the company and the work that they were doing in trying to solve the challenge of progressive secondary multiple sclerosis, which is a very debilitating disease and one that I had the opportunity to treat patients when I was in practice.
I'm aware
I studied the company for a period of time and felt that it had some significant merit and promise and purchased the initial shares on the stock exchange
Congressman
itself.
Price, I have very limited time. Let me go on. Your purchases occurred while the 21st Century Cures Act, which had several provisions that could impact drug developers like Innate Immunotherapeutics, was being negotiated. And again, just days before you were notified to prepare for a final vote on the bill. Congressman, do you believe it is appropriate for a senior member of Congress actively involved in policymaking in the health sector to repeatedly personally invest in a drug company that could benefit from those actions? Yes or no?
Well, that's not what happened.
Well, let me just say that I believe it's inappropriate, and we need answers to this regarding whether you and Congressman Collins used your access to non-public information when you bought at prices that were unavailable to the public. And again,
I had no access to non-public information.
Well, we will go on. Congressman Price, just last week, you and Republicans in Congress voted to begin ripping apart our health care system, which would cause nearly 30 million people to lose their coverage and raise health care costs for families without telling the American people specifically what you plan to do instead. President-elect Trump and Republicans in Congress have promised to deliver a plan that prevents anyone from losing coverage and leaves no one worse off. Just days ago, President-elect Trump said his plan would provide insurance for everybody. Do you share those goals?
I think it's absolutely imperative that we have a system in place that has patients at the center and allows for every single American to have the opportunity to gain access to the kind of coverage that they want.
You share his goal of insurance for everybody?
That's been always my stated goal. It's what we've worked on and throughout my entire public career.
Okay. If your repeal plan, the Empowering Patients First Act, was signed into law, would you consider these commitments to ensure all Americans and leave no one worse off be met?
The goal of the bills that I've worked on here in Congress, and understanding that the role, if I'm given the privilege of leading at HHS, is different, but my role in Congress was to always make certain that individuals had the opportunity to gain access to the kind of coverage that they desired, and that they had the financial feasibility to do so.
Okay.
That's what's different about the plans that we put forward.
All right. Well, I think it's really important that we have clear answers. So let me just say this. Your bill only allows people with pre-existing conditions to obtain health insurance if they maintained continuous insurance for 18 months prior. Millions of Americans with pre-existing health conditions lack insurance for short periods of time. Under your plan, insurance companies could deny those Americans coverage for pre-existing conditions, yes or no, under your bill?
It's a broader question than that, because we would put in place high-risk pools and individual health pools that would allow every single person in the individual and small group market, who are the ones challenged with pre-existing illness, to be able to gain access again to the coverage that they want. So we believe through that plan that every single person would have the opportunity and financial feasibility to gain the coverage that they want for themselves and for their families.
We disagree on the consequences of that. Your bill would repeal dependent coverage available to young adults up to age 26. That is correct, right?
The bill that I authored did not include coverage up to age 26. The insurance companies have said that they were working that they were including that in their plans going forward, and so we felt it was covered.
Okay, and your bill takes away current benefits, which include prescription drugs, mental health and substance use disorder benefits, and maternity coverage, among others. That is correct, right?
Again, it's different in the legislative arena than it is in the administrative arena, but there are other factors that we would put in place that would make certain that individuals had the care and the kind of coverage that they needed for whatever diagnosis would befall them.
Again, I disagree with the consequences, but your bill didn't cover that. Your bill also repeals the lifetime limits on coverage that helps a lot of people who are sick and have high medical expenses, like a person with cancer. Yes or no?
Well, again, it's a larger question, because what we would put is a different construct in place that would allow for every single person to gain access to the coverage that they want and have nobody fall through the cracks.
Well, I think just with these questions, I'm very concerned that your vision for a health care system is very different than one that I think millions of Americans are counting on.
Thank you, Senator Murray. Senator Enzi.
Thank you, Mr. Chairman, and thank you, Dr. Price, for being willing to serve and to go through this process. I call this gotcha management. Nothing is barred, and the idea is to get you to take questions on short notice in public that you wouldn't have done what you normally do. I've worked with you for the last 2 years, meeting with you at least once a week, every week that we've been in session. So I know how you operate, and I appreciate how you operate, and the care and the focus and the concern and how comprehensively you think about particularly the medical things. One of my concerns is always the rural areas, because Wyoming is the most rural state in the nation. I hesitate to do that because last night at the education hearing, I got to hear from Mrs. DeVos, who remembered a conversation from a month before that I had on a rural problem, which dealt with grizzly bears by the Wapiti School in Wyoming. And that became a major topic around here, and I'm glad everybody recognizes that need and concern. Now, part of the story was that that's the grade school that former Senator Craig Thomas went to, and when he was there, they didn't need that fence because he was tough. But there are different kinds of problems in different places in the healthcare area. I have a county that's the size of Delaware. It has one community that would like to say that it has 2,500 people. It does have a hospital, but when you have a rural community, a rural county that big, with that small of a town, it's difficult to keep a doctor. Without at least a PA there, the hospital has to close. And if that hospital closes, emergency care is 80 miles away. Not a likely story in most of the places, and we need to make sure that those things are covered. And I've appreciated getting to share those with you over the period of time. I was always curious as to why you left a very successful practice and were willing to come back here and try to make a difference, and I want to congratulate you on the difference that you have made. Now one of the questions I'd ask you is, why are you willing to leave a place with so much responsibility and background and capability to be willing to be the Secretary of Health and Human Services?
Thank you, Senator. When I think about the mission of the Department of Health and Human Services, which is to improve the health, safety, and well-being of the American people, it's what I've literally spent my life trying to do. And so to have the opportunity to participate, if confirmed, to serve as the Secretary of Health and Human Services and try to guide that organization in a direction that would further fulfill that mission, I can't think of anything more exciting or fulfilling.
Well, and I think you have the background for doing that, too, with the wide range of experience you had between the different practices and hospitals, and then coming here and going through a number of different committee situations. But what you're about to go through is rather intense, and then that's followed by probably the most productive part if senators happen to read the answers, and that's that we get to do written questions as well, which we hope you'll provide a rapid response on. But those aren't nearly as much fun for the panelists because they aren't in public. I'll move to some questions that are a little bit more related here. Because we begin serious and challenging task of restoring these health insurance markets, which are teetering on the brink now. Some are collapsing. Some counties you can't get coverage. In Wyoming, there's only one provider. And it's my understanding that the incoming administration may have the ability to make some key policy changes immediately. Some of the most critical changes for short-term stabilization of the markets might include reducing the number of special enrollment periods and requiring upfront verification, or aligning grace periods for non-payment of premiums with state law. My understanding from those in the insurance business is that some targeted actions by the Department of Health and Human Services may provide some meaningful changes that could impact premiums for the next year. Are those some options that you might consider?
I think absolutely. The insurers, as I think the chairman mentioned, are deciding right now, as they come forward in March and April, what the premium levels will be for 2018, calendar year 2018. What they need to hear from all of us, I believe, is a level of support and stability in the market, the kinds of things that make it so that they're able to provide product to patients out there. You mentioned that there are counties in your state where there's only one provider. There are 5 states in this nation where there's only one insurance provider. There are 1/3 of the counties in this country only have one insurance provider. We must, as policymakers and as folks administering these programs, we must ask ourselves, what's going on? Where are the problems out there? That may work for the insurers in certain instances. It may work for government, but it doesn't work for patients. And so if we keep the patients at the center of all of this, we'll get to the right answer, and that's what I hope to do with each and every one of you.
I appreciate that, and I got to work for years with Senator Kennedy on biologics and biosimilars, and having the requirements for their biosimilarity and interchangeability has needed some additional information. The FDA has issued guidance documents since the law passed, but they haven't set policy on interchangeability with a reference product. I was concerned that in 2017, having gone through nearly 2 full presidential terms, that just yesterday we finally got a draft of the FDA's interchangeability policy. I'll ask that question since my time has expired in writing. Thank you.
Thank you very much, Senator.
Thank you, Senator Enzi. Senator Sanders.
Thank you, Mr. Chairman, and Congressman Price, thanks for being here, and thanks for the conversation we had the other day.
Thank you.
Congressman, on May 7th, 2015, well, let me begin by saying all of us know that we have come through a very unusual election process. President-elect Trump received almost 3 million votes less than Secretary Clinton, but he won the Electoral College. He's going to be inaugurated this week. He won a number of states by rather slim margins. During the course of his campaign, Mr. Trump said over and over again that he would not cut Social Security, not cut Medicare, not cut Medicaid. Let me read some quotes. On May 7th, 2015, Mr. Trump tweeted, "I was the first and only potential GOP candidate to state there will be no cuts to Social Security, Medicare, and Medicaid." On April 18th, 2015, he said, quote, "Every Republican wants to do a big number on Social Security. They want to do it on Medicare. They want to do it on Medicaid, and we can't do that. And it's not fair to the people that have been paying in for years, and now all of a sudden they want to be cut," end of quote. August 10th, 2015, Mr. Trump said, quote, "I will save Medicare, Medicaid, and Social Security without cuts. We have to do it. People have been paying in for years, and now many of these candidates want to cut it," end quote. March 29, 2016, Trump said, "You know, Paul Ryan wants to knock out Social Security, knock it down, way down. He wants to knock Medicare way down. And frankly, well, 2 things. Number 1, you're going to lose the election if you're going to do that. I'm not going to cut it, and I'm not going to raise ages, and I'm not going to do all of the things they want to do. But they want to really cut it, and they want to cut it very substantially, the Republicans. And I'm not going to do that," on and on and on. Point being, this is not something he said in passing. I think it is likely he won the election because millions of working-class people and senior citizens heard him say he was not going to cut Social Security, Medicare, and Medicaid. Congressman Price, a very simple question. Is the president-elect, Mr. Trump, going to keep his word to the American people and not cut Social Security, Medicare, and Medicaid, or did he lie to the American people?
I haven't had extensive discussions with him about the comments that he made, but I have no reason to believe that he's changed his position.
All right, so you are telling us that to the best of your knowledge, Mr. Trump will not cut Social Security, Medicare, and Medicaid.
As I say, I have no reason to believe that position has changed.
Congressman Price, quoting Mr. Trump again, or at least paraphrasing him, just last week he said, roughly speaking, "Pharma is getting away with murder." You recall that tweet?
I do.
Okay. There are many of us on this side of the aisle who are working on legislation that would do at least 2 things. Number 1, end the absurdity of the American people being ripped off by the pharmaceutical industry, who 2 years ago made top 5 companies made $50 billion in profits, while 1 out of 5 Americans can't afford to fill the prescriptions their doctors write. Will you And will the President-elect join us in legislation we are working on, which, number one, will allow Medicare to negotiate prices with the drug companies and lower prices, and number two, allow the American people to bring in less expensive medicine from Canada and other countries? Is that something you will work with us on?
The issue of drug pricing and drug costs is one of great concern to all Americans. I think it's important to appreciate that in a couple areas we've had significant success, whether it's in the generic area where costs are significantly less than they have been, and in part...
But you are aware, sir, I don't mean to be... we don't have a lot of time. We are paying by far the highest prices in the world for prescription drugs. You don't disagree with that, do you? Do you disagree with that?
I think that's the case. I'd have to look at the statistics. I think
case.
there are a lot of reasons for that, and if we get to the root cause of what that is, then I think we can actually solve it in a bipartisan way.
One of the root
Solve it
causes
together.
is that every other major country on earth negotiates drug prices with the pharmaceutical industry. In our country, the drug companies can raise their prices. Today, they could double their prices. There is no law to prevent them from doing that. Will you work with us so that Medicare negotiates prices with the pharmaceutical industry?
You have my commitment to work with you and others to make certain that the drug pricing is reasonable and that individuals across this land have access to the medications that they need.
Wasn't quite the answer to the question that I asked. Congressman Price, the United States of America is the only major country on earth that does not guarantee health care to all people as a right. Canada does it. Every major country in Europe does it. Do you believe that health care is a right of all Americans, whether they're rich or they're poor? Should people, because they are Americans, be able to go to the doctor when they need to, be able to go into a hospital because they are Americans?
Yes, we're a compassionate society.
No, we are not a compassionate society. In terms of our relationship to poor and working people, our record is worse than virtually any other country on earth. We have the highest rate of childhood poverty of any other major country on earth, and half of our senior older workers have nothing set aside for retirement. So I don't think compared to other countries we are particularly compassionate. But my question is, in Canada, in other countries, all people have the right to get health care. Do you believe we should move in that direction?
If you want to talk about other countries' health care systems, there are consequences to the decisions that they've made, just as there are consequences to the decision that we've made. I believe, and I look forward to working with you to make certain that every single American has access to the highest quality care and coverage that is possible.
Has access to does not mean that they are guaranteed health care. I have access to buying a $10 million home. I don't have the money to do that.
And that's why we believe it's appropriate to put in place a system that gives every person the financial feasibility to be able to purchase the coverage that they want for themselves and for their family. Again, not what the government forces them to buy.
Yeah, but if they don't have any, well, that's a longer story. Thank you very much.
Thank you.
Thank you, Senator Sanders. Senator Hatch.
Well, thank you, Mr. Chairman. Welcome to the committee. Having worked with you over the years, I've found you to be always very, very knowledgeable.
Thank you.
Very upfront, very straightforward, very honest, and somebody who really understands the healthcare system of this country. And you're just perfectly situated to be able to help turn it around and get it so it works. We hear a lot from our other side about how bad the system is and so forth, and I've got to tell you, I don't think it's very good myself. And we've got to work on it and get it done right. But boy, I'd sure like to have you right there helping to get it done, because you're one of the really premier people in this whole Congress and in the world, as a matter of fact, understanding what needs to be done and yet recognizing the problems of getting it done. Now, Dr. Price, some of my colleagues have criticized you for your health-related stock holdings while serving in the House. Now, not only do House rules not prohibit members from trading stocks, but it is also not an uncommon practice for members of Congress. In fact, there are members on this committee who have, as I understand it, who have traded individual health stocks while serving on this committee. Now, this appears to be nothing more than a hypocritical attack on your good character. And I personally resent it, because you have always disclosed. But let me just say this. Can you confirm that you have always followed the law relating to trading in stocks while serving as a member of Congress?
Thank you, sir. Everything that we have done has been above board, transparent, ethical, and legal. And as you know, and the members of this committee know, There's an organization that's called the Office of Government Ethics that
Right.
looks at all of for every cabinet nominee, looks at all of the possessions, all the holdings and the like, and makes a recommendation as to what that cabinet member must do in order to make certain that there's no conflict of interest. The Office of Government Ethics has looked at our holdings and given advice about what would need to be done in terms of divesting from certain stock holdings to make certain that there's no conflict of interest. We have read those and agreed to those, signed those. That document is online for everybody to see so that everybody is absolutely certain that there will be no conflict of interest whatsoever.
Well, thank you, and you followed their advice.
Absolutely.
Well, Dr. Price, the collapse of Obamacare has exacerbated our nation's health care problems. Too frequently, my colleagues and I have seen European idealism strangle functional insurance design with cost-prohibitive measures. And despite these failed reforms, I don't think we can lose sight of the broader health system that is at risk. For example, rare disease patients do not have access to life-saving treatments because policies that stem from Obamacare prevent investments in innovative therapies that can cure and save lives. Now, this is an issue that I'm deeply passionate about. Dr. Price, what steps do you believe will improve the pipeline for rare disease therapies to bring treatments and cures to patients in desperate need of hope?
Well, the Orphan Drug Act, which passed, I think, 30 years ago or so, was
my
really
first bill, by the way.
And it really has revolutionized the ability to treat rare diseases. And what it did is make the United States the leader in coming forward with treatments for rare diseases. And I think that there are things that we can do in terms of patent protection, in terms of liability, in terms of incentivization, resources to be able to encourage the discovery of cures for rare diseases.
And we have a lot more drugs coming through, and even some blockbuster drugs that came because of that little bill.
Yes.
We just put some incentives in effect, and all of a sudden there's an explosion in orphan drugs for population groups of less than 200,000 people. It's a pretty important little bill. It
One of the
cost a lot of
success
money,
stories.
but it was a Republican bill.
Yeah. One of the success stories, truly, for public policy in the country.
Right. Now, Dr. Price, one of the central duties of the HHS Secretary is to be diligent and thoughtful when considering if federal regulation is necessary and assessing whether the regulations impede research, development, and innovation. Over the years, the regulatory infrastructure guiding dietary supplements has changed dramatically. Do you recognize the importance of dietary supplements in helping Americans reach and maintain healthy lifestyles?
Absolutely.
And will you commit to me and other members of the committee to work to ensure appropriate regulation and implementation of the Dietary Supplement Health and Education Act so that we can protect public health while assuring consumers continued access to safe products?
Yeah, this is one of those areas where it's incredibly important to gain the information that you referred to gather the individuals that know the most about this area, whether it's consumers, whether it's those providing the product to market, make certain that there are protections for unadulterated products, but it's absolutely vital that we get this right.
Well, I'll tell you this. I have to commend Donald Trump for picking you.
Thank you.
You're clearly one of the premier people in all of Congress who understands the problems of health care. And you have the professional background that I don't know any other member of Congress can match to help solve the problems that we have. We've got a real messy situation here. And Obamacare has not really helped. Do you think Obamacare has helped?
I think that some of the things that have occurred with the passage of the ACA have improved certain areas. The coverage is certainly improved. But the consequences of that, I mean, that many people, as I mentioned before, have coverage, but they don't have care. So there's so many things about just the decision-making process. Who decides about our health care? Should it be the federal government, or should it be patients and families and doctors? And we certainly believe the latter as opposed to the former.
I take it that you believe that getting health care closer to the people is a far better thing than everybody pontificating from Washington, D.C.
I think the more involvement that patients and families and doctors can have in medical decisions, the higher quality care we'll have.
In my earlier life, I was one of the things I did was I was a medical liability defense lawyer, defending doctors, hospitals, nurses, healthcare providers, et cetera. What do you think we should do about medical liability?
This is really a difficult challenge because it's not just the malpractice rates that doctors or hospitals pay, but it's the practice of defensive medicine, which are the things that physicians do that don't hurt anybody, but they're tests and procedures and examinations that aren't necessarily needed to either make a diagnosis or to treat the patient.
But show up in their history.
But it shows up in their history so that if they're called into a court of law, they can say to the judge and the jury, I don't know what you wanted me to do because I did everything. When in fact everything is rarely necessary to either treat or to diagnose the patient. So if we look at it in that light and try to focus on decreasing the practice of defensive medicine to the benefit of patients, then I think we can get to the right answer, and there's some exciting opportunities out there that have been bipartisan in the past.
Well, thank you, sir. I think you're a great nomination.
Thank you.
Thank you, Senator Hatch. Senator Casey.
Thank you, Mr. Chairman. Representative Price, we're grateful you're here, and thanks for the visit to our office.
Thank you.
And I wanted to highlight something we probably don't spend enough time highlighting or talking about, and that's the full protections of what was known as the original bill, the Patient Protection and Affordable Care Act. We've had a lot of shorthand terminology since then. And I know you and I have a basic disagreement. I think it's important to be candid about that. But I think what a lot of people have forgotten about is that, the chairman had a chart earlier that outlined the categories of Americans that have health insurance by virtue of various programs, or I think the number he had on that poster about the number of Americans in the employer-sponsored coverage category, I think it was 178 million people. That's a lot of folks with coverage who had coverage before. Most of them, I guess, would have had coverage before the legislation and after, meaning they're paying their premiums and had coverage, but they didn't have protections that only came with the passage of the legislation. We know that somewhere between 11 and 12 million people have purchased health insurance through the individual marketplace. And so I want to ask you a couple of questions about those basic protections that are now law that were not law before. I think you'd agree with me, and you know from your practice, that you meet just remarkably inspiring people in your work, and once in a while here in the Senate we do as well. Probably don't take enough time to have those opportunities. But one of the people I met in the lead up to the legislation passing was Stacy Ritter. She was from Manheim, Pennsylvania. She didn't have a personal challenge. It was the challenge faced by her two daughters. They were 4 years old, Madeline and Hannah. And as she said, as Stacy said about her daughters, she said that they would be, at that time, before the passage of the bill, punished and rejected because they had the misfortune of developing cancer as a child. And her basic problem was the caps on treatment. So the first question I'd ask you in terms of your work as Secretary of Health and Human Services, should you be confirmed, would be, will you commit to maintaining the protections that ensure that no child is denied insurance coverage because of pre-existing conditions?
Well, I think that's pediatric cancer is one of those things that is remarkably challenging. I remember when I was in my residency and did a rotation on the pediatric orthopedic ward, and so many of those children had cancer. And I before I began that rotation, I almost dreaded going to that month because I was worried about just the severity of the challenges that I would meet. I'll tell you, it was one of the most uplifting months I spent in medical school, and that was because the children were so uplifting. And so absolutely we need to make certain that every single child has access to the kind of coverage that they need and the care that they need. And there are a number of ways to do that, and I look forward to working with you to make that happen.
I heard the word yes there. Secondly, and it's really hard to believe that we even have to ask a question about this next topic, which is victims of domestic violence. It was the state of the law prior to the passage of the legislation that victims of domestic violence were considered Americans who had a pre-existing condition. It's still the law in some states that they are not protected. So question number two is, will you commit to maintaining the protections that ensure that victims of domestic violence will not be discriminated against when purchasing health insurance? Yes or no?
Yeah, I think it's absolutely vital that victims of domestic violence and others, anybody, we need a system in place that ensures that individuals are either not priced out of the market because they get a bad diagnosis, or not eligible or able to purchase coverage that works for them because of their diagnosis.
In limited time, I want to interrupt. I don't want to get hung up on priced out of the market. What I'm asking for is an ironclad guarantee that circumstance, that horrific circumstance, will never be a bar to coverage, treatment, or care.
Well, it certainly shouldn't be, and as you well know, if I'm fortunate to be confirmed, that's an administrative role, and it's the policy decision that the legislators would make.
Well, I think we can agree on that. Number 3, will you maintain to committing the protections that prohibits discrimination in health insurance on the basis of health status or disability? Yes or no?
Again, I think it's absolutely imperative that we have a system in place that works for patients, and anybody not being able to gain access to the coverage that they want or need is not a system that works for patients.
And I'll follow up with more questions. What I'm getting at here is that we had a state of the law before passage of the ACA where individuals like that, whether they happen to have a child had a pre-existing condition, even if their parents were paying premiums for years, an insurance company could literally say, sorry, you have a pre-existing condition or your child does, you can't get coverage. Women were discriminated against because they were women. Just a remarkable stain on America that we allowed that to happen. My concern, though, now is not just a series of concerns about what you've proposed as a member of the House and what you could do as Secretary. But I just heard earlier that the 3 areas that will be of focus in whatever replacement plan there is, and I'm anxious to see it, would be, and I wrote them down, I think Chairman Alexander wanted to take off the table, and that's a good thing, Medicare. But I heard that there'll be 3 targets. That's my word, of course. The individual market, Medicaid, and employer-sponsored coverage. So I hope if employer-sponsored coverage is a subject of change, that will ensure all those protections that are in place right now. And that's why I'm asking those questions. I'll follow up more in writing, or if we get another round. And Mr. Chairman put me on record as incorporating by reference everything Ranking Member Murray said about questions and an additional round. Thank you.
Thank you, Senator.
Thank you, Senator Casey. Duly noted, and I appreciate you using your 7 minutes to ask questions. Senator Isaacson has deferred to Senator Paul.
As a fellow physician, and as a fellow physician who did some of my training at Grady, congratulations. And I wish everybody on the committee could come to Grady and see you working there, see what it's like to work in one of our nation's biggest charity hospitals, often doing work that is just incredible. Gunshot wounds, compound fractures of the femur, you name it. And I remember being there as a student and then as an intern some, and we used to always calculate how many hours and divide by our income and say, boy, we wish we could get minimum wage. But I think it is important that we get somebody with that kind of clear reasoning and critical skills, to be in charge of our government, both knowing about the medical aspect as well as, the public policy aspect. I think what I regret about this kind of hearing, and I think what a lot of people in America regret about is sort of the vitriol and the rancor and the partisanship that should go into something that we kind of all want the same things. And to question your motives, I think, is insulting. To question whether you're honest is insulting. The whole question of, and I guess this would be my first question to you, did you go into public service to enrich yourself or for public service?
I have a passion for public service and a passion for people, and that's what guided our decision that some might think was a foolish decision for both of us to.
Did you take a pay cut to go into public service?
I didn't consider the remuneration for public service.
Right. but I'm guessing it would have been a pay cut. The motives as to what we should do, see, I think we aren't separated that much on our motives. I think we all want the most amount of insurance for people at the least amount of cost. We want, people to get access to health care. What are your motives? What are your goals? What should we do with the health care system? Do you want more people to be insured? Do you want more people to have health care? Or do you think we disagree just on how we do it and not necessarily the motives?
No, as I tried to lay out earlier, and I know time is short for everybody, but the principles that I think are absolutely imperative for a healthcare system is one that's affordable for everybody, one that provides access to health care and coverage for everybody, one is that's of the highest quality, that is responsive to patients. System isn't any good if it's not responding to patients. One that incentivizes innovation because it's the innovation that drives the high quality health care, and then one that ensures choices are made and preserved by patients. So patients ought to be the ones choosing who's treating them where, when, and the like.
You and us by extension, Republicans by extension, have been accused of having no replacement ideas, no ideas for how to fix the system. Approximately how many bills do you have that could be regarded as replacement bills or ways to improve the health insurance system in our health care?
We've had one large-term bill since March or early 2009, and then beyond that, tens of pieces of legislation to address the health care issue.
It's also been insinuated that America is this horrible, rotten place, that we don't have compassion, and I guess by extension the physicians don't. Well, as you worked as an emergency room physician or as you worked as a physician, did you always agree as part of your engagement with the hospital to treat all comers regardless of whether they had an ability to pay?
It's one of the things we pride ourselves upon, and that is that anybody that showed up in need of care was provided that care, and that was true not only in our residency but in our private orthopedic practice as well.
And it's interesting that those who say we have no compassion, extol the virtues of socialism. And you look at a country like Venezuela with great resources and an utter disaster where people can't eat, devolving into violence. And, I think it is important that we do have a debate ultimately in our country between socialism and communism and America and capitalism. One of the things that's extraordinary about our country is that just 2 years ago, in 2014, we gave away $400 billion privately, not the government, individually to your churches and to charities. We're an incredibly compassionate society, and I think often this was misplaced in sort of the wonky numbers of this number and that number within healthcare. How much we do help each other. Not only do we help each other on our country, I'll bet you half the physicians in my community in Bowling Green have gone on international trips and done international charity work. And all that is lost in saying that we're this heartless, terrible country. And I would just argue the opposite. I think the greatness of our country and the greatness of the compassion of our country, we give away more than the gross domestic product of most of these socialized countries around the world. So I think it is important. With regard to replacement, a couple of things. There are some big, broad ideas that I think would insure more people. One is the idea of legalizing the sale of all types of insurance. Under Obamacare, we made it illegal to sell certain types of inexpensive insurance. Do you think we could insure more people and help some of the people who actually don't get insurance under Obamacare to get insurance if we would legalize the sale of more types of insurance?
I think choices, as I mentioned, is absolutely vital, and I know that if we have as a principle and as a goal having patients have those choices, then I believe that patients will select the kind of coverage that they want. The choices that ought to be available to them are a full array of opportunities.
You think health savings accounts will help also some people that are not helped currently? I think
health savings accounts and high deductible catastrophic coverage are things that make a whole lot of sense for many individuals, and we ought not force anybody to do anything. It ought to be a voluntary choice, but they ought to have the choice to be able to select them.
And one of the things you've had different legislation on, and I'm a big supporter of, is allowing individuals to join together in groups to buy insurance. Do you think this has a possibility of what Senator Alexander talked about, the millions of people in the individual market? I have great sympathy for that. I was a small physician with 4 employees, and if one employee were to get sick, it could be devastating to not only to them but also to the economics of keeping them employed. but letting us join together into pools where instead of me buying insurance as one of 4 people, I could buy it in a big group, maybe 100,000 people, maybe 1 million people. And currently the laws kind of prevent that, but you had some bills for expanding that, and I'm a big fan of that. Could you mention some of the association health plans and how that might help some people to get insurance who don't have insurance currently?
Yeah. Thank you. Association health plans are one of those entities that would allow individuals who are economically aligned in some way to be able to purchase coverage together, even though they don't necessarily work together or in the same group. Individual health pools, which I think is one of the secrets to being able to solve the individual and small group market conundrum that we find ourselves in, would allow anybody to pool with anybody else solely for the purpose of purchasing health coverage. It's not a new idea. The model for it is actually the Blue Shield plan that existed decades ago that allowed people to pool their resources together for major medical coverage for hospitalization. And it just makes a lot of sense. It allows insurance to work the way it's supposed to work, which is to spread the risk, and then anybody's adverse health status doesn't drive up the cost for them or anybody else because the pool is large enough.
Thank you, Senator Paul. Senator Franken.
I'll tell you how we get a really big risk pool. It'd be called Medicare for everyone. That would be the biggest risk pool. Dr. Price, it was nice meeting you the other day.
Yeah, it was good.
Did you enjoy meeting me?
Thank you. I did. I did. I enjoyed our discussion about our gray hair.
Yeah. Dr. Price, what is the leading cause of preventable death in the United States?
I'll defer to you. You've obviously got it on the page in front of you.
I actually knew this before I put it on the page. It's smoking.
Well, that hits home. I lost my dad, who was a Lucky Strike smoker from World War II to emphysema, and he prided himself on the fact that he never smoked a cigarette with a filter for years and years, and it was incredible tragedy.
I lost my dad, too.
Yeah.
As a physician, you may know, I guess you didn't, that smoking kills approximately 480,000 Americans each year and totals $170 billion each year in healthcare costs. And yet, between 1993 and 2012, you were a shareholder of tobacco, of big tobacco companies, meaning that you personally benefited from tobacco sales. Meanwhile, you voted against landmark legislation in 2009 that gave the FDA the authority to regulate tobacco. Congressman Price, you're a physician, which means you took the Hippocratic Oath, a pledge to do no harm. How do you square reaping personal financial gain from the sales of an addictive product that kills millions of Americans every decade with also voting against measures to reduce the death toll inflicted by tobacco?
Well, it's an interesting question, Senator, and it's a curious observation. I have no idea what stocks I held in the 90s or the 2000s or even now. All of these decisions for all of us, I suspect, are through mutual funds and through pension plans. I would bet, and I don't want, well, I ought not bet here. I would suspect that in your pension plan, that there are components of that are held that may have something to do in some time in your history with tobacco. So
I find it very hard to believe that you did not know that you had tobacco stocks. I find it a little hard to believe that in the questions about your stock portfolio, you've said you didn't know things. Just over the last 4 years, you traded more than $300,000 in health-related stocks, while at the same time sponsoring and advocating legislation that could affect the performance of those stocks. Now, we've talked a little bit about the Zimmer Biomet. Your broker, you say, you didn't know this, bought it on March 17, 2016. You did introduce a bill later, a week later, on March 23rd, 2016, you say that you did not know then that you had this stock. It was a rule it was to delay a federal rule that would have reduced the profitability of the company's joint to delay a rule that would hurt the company. What I don't understand is once you found out that your broker bought it, you kept the stock. You purchased this $50,000 to $100,000 worth of stock in a biomedical company called Innate Immuno. We've talked about it a little bit. It's the single largest purchase in the past 3 years in a private deal that was not made available to the public. And I find it absolutely amazing that you responded that you did not know that you got a discounted price. That is absolutely amazing because we discussed this.
Well, by definition, I believe that's the nature of a private placement offering. What I said to you and what I've said to others is that I paid exactly the same price as everybody else. I disclosed it.
It was a private offering that only went to about 20 people, including Representative, your colleague, Chris Collins, his chief of staff, and a prominent D.C. lobbyist. And you reported $50,000 to $100,000 in profits on this purchase. It really begs credulity, sir, when you say you did not know that you got a discount on this. This was a private offering to a very small number. When you have the committee, chairman of the budget committee, when you have a congressman as chief of staff, these sound like sweetheart deals, and I think that our job in this body and in Congress and in government is to avoid the appearance of conflict. And boy, you have not done this. I want to talk just about your latest plan, Empowering Patients First Act. Some of it is detailed in this article from the New England Journal of Medicine. It's called Care for the Vulnerable versus Cash for the Powerful, Trump's Pick for HHS. I'll just read a random paragraph. Price's record demonstrates less concern for the sick, the poor, and the health of the public, and much greater concern for the economic well-being of their physician caregivers. And I would commend this to every member of this committee before making a vote, because what your plan does is, one of the things, it gives a tax credit to Americans to buy health insurance. It's no different for someone who's poor or someone who makes $20,000, $30,000, and to Bill Gates. It is an incredibly regressive system. You have talked about ending you guys want to end the expansion of Medicaid. That has people in Minnesota scared out of their mind. Look, I've heard a lot, Obamacare has been a disaster. First of all, you have to admit that it's bent the cost curve, that the cost of health care in this country has grown less than it did in the previous 10 years. It's also covered 20 million more people, but forget them. In 2008, I would go around the state of Minnesota in every VFW hall, in every cafe, I would see a bulletin board where it would have a burger bash or a spaghetti dinner for someone who had gone bankrupt because they had gone through their annual cap or their lifetime cap. I am very frightened about what you are going to do, and so are millions of Americans. And frankly, I know that you do things that help that physician groups. You've put in provisions that would prevent these findings by efficiency and innovation boards that would have to be cleared by physician groups. I see you as someone who is there for the doctor, and that this is a cover for This is not going to create access for all Americans, what you talked about, the Empowering Patients First Act. This is going to unravel something that has given a lot of Americans peace of mind, knowing that their kids can stay on their health care till they're 26, knowing that if they have a pre-existing condition, that won't stop them from getting care. That's what this hearing should be about. And you're a smart man.
Senator, we're a minute over.
Okay, and my second round, I will be a minute short.
Sure.
Okay, thanks.
You may be here by yourself.
I'll be here with him.
You know, the
Thank you,
Benghazi
Senator
hearings
Franken.
was 11 hours. That's all I'm saying.
Thank you, Senator Franken. Senator Isaacson.
Congressman Price, since that question ended with him not having any time to give you a chance to respond to it, do you have any response to Senator Franken?
Yeah, I would just say that this is one of the things that makes it difficult to reach a solution here in Washington. The concerns that were expressed by the senator are valid concerns. The conclusions that he drew on the policies that I've promoted and will continue to promote are absolutely incorrect. We all share a concern for the American people and how we best make certain that they have access to the highest quality care that the world knows. And so I hope, and I understand why he's doing it. I mean, this is a political activity. I understand that. But I hope that we're able to work together, if I'm given the privilege of leading and serving as the Secretary of Health and Human Services, to truly solve these difficult challenges that we have in our nation.
Congressman Price, isn't it true that by the date of May 15th of every year since you've served in Congress, you've had to make full disclosure of everything you own, everything your wife owns, what it's worth, when it was acquired, and what it was sold for?
Every single year we do a yearly financial disclosure, and the House requires a monthly periodic transaction form that updates that if there's any significant change.
Isn't it true that every transaction that's been referred to in questions of you were available to the public to find on the records of the Senate Ethics Committee and the House Ethics Committee?
Absolutely, and they remain so today.
These are not discovered things that were hidden. They're, in fact, facts that we require you to disclose every year?
No, in fact, there isn't a single bit of information that's out here that I didn't reveal to the public in a transparent process.
Isn't it true that transparency is the antiseptic that creates the environment where there is no corruption?
Sunshine cures disease. That's exactly right.
Isn't it correct that you've worked throughout your career in the Georgia Senate, United States Congress, and I'm sure you will as Secretary of HHS, to be sure there's always transparency?
Absolutely. It's a hallmark and a key, especially in the area of health care and in the services that HHS provides.
Is it not true that you love your country, you love your job, and if you have the opportunity to be Secretary of Health and Human Services, you'll do everything you can to disclose everything possible so there's never an appearance of any conflict of interest whatsoever?
Without a doubt, and that's why I mentioned the Office of Government Ethics and the work, the diligence that they do to look at everybody's holdings and assets who are scheduled to potentially serve as in the cabinet, and then they make a recommendation, a very specific recommendation that's also available to be seen online, and we have agreed to every single recommendation that they made to divest of whatever holdings we have that might even give the appearance of a possible conflict.
Mr. Chairman, I yield back the balance of my time.
Thank you, Senator Isaacson. Senator Bennett.
Mr. Chairman, and thank you for the 7 minutes as well. And I should tell you that I have never shown my knee, to any nominee before Dr. Price came to my office, but he gave me some free medical advice, and I'm grateful.
How you doing?
Free health care. It's terrible, but I'll talk to you after it's over. It's not because of you.
I can't ask you, but I'm curious as to whether or not you've gotten the MRI yet.
Today. 3 o'clock,
Good.
so I'll let you know. Congressman, I enjoyed our conversation, and it's good to see you here. I know you've been chair of the House Budget Committee. I know you're a member of the Tea Party, been a strong advocate of balancing the budget, introducing a balanced budget for a stronger America, it's called. What I've noticed is that after gaining control of the House, the Senate, and the White House, the first order of business for the Republican majority here has been to pass a budget resolution repealing the ACA, And this budget resolution specifically authorizes $9 trillion in additional debt over the next 10 years. It also rigs the bill in secret to block any point of order to the bill because that bill will increase the deficit. And let me read my colleague, a smart guy who's here, Senator Paul, so astutely highlighted in his floor speech on January 4th. He said, quote, "The more things change, the more they seem to stay the same. Republicans won the White House. Republicans control the Senate. Republicans control the House. And what will be the first order of business for the new Republican majority? To pass a budget that never balances. To pass a budget that will add $9.7 trillion of new debt over 10 years. This is a facsimile of his chart. Is that really, he asked, what we campaigned on? Is that really what we campaigned on? The quote goes on, why would we vote on a budget that adds $9.7 trillion to the debt? Because we're in a hurry. We can't be bothered. It's just numbers. I was told again and again, swallow it, take it. They're just numbers. Don't worry, it's not really a budget. And yet the legislation says it's a budget. Quote, so this is what Republicans are for. This is the blueprint that the Republican Party says they're for. $10 trillion worth of new debt. I'm not for it, said that honest man. Rand Paul is right. The repeal law overrides two separate budget provisions already passed by the Senate that prevent increasing the deficit by more than $10 billion in a given year, increase the deficit more than $5 billion in years further down the road. So I ask you, sir, are you aware that behind closed doors, Republican leadership wrote into this bill that any replacement to the Affordable Care Act would be exempt from Senate rules that prohibit large increases to the deficit?
As you may know, Senator, I stepped aside as chairman of the Budget Committee at the beginning of this year, and so I wasn't involved in the writing of
You have been the Budget Committee chairman during the rise of the Tea Party. You're a member of the Tea Party caucus. You have said over and over again, as other people have, that the reason you've come to Washington is to reduce our deficit and reduce our debt. I assume you're very well aware of the vehicle that is being used to repeal the Affordable Care Act. This is not some small piece of legislation. This is the Republican budget.
Yes, I'm aware of the bill, yes.
So do you support a budget that increases the debt by $10 trillion?
No, what I support is an opportunity to use reconciliation to address the real challenges in the Affordable Care Act and to make certain that we put in place at the same time a provision that allows us to move the healthcare system in a much better direction.
Do you support the budget that was passed by the Senate Republicans
I
to
support,
repeal the Affordable Care Act that adds $10 trillion of debt to the budget deficit?
well, the reconciliation bill is yet to come. I support the process that allows for and provides for the fiscal year 17 reconciliation bill to come forward.
Will you commit today that any replacement plan for the Affordable Care Act will not in any way contribute to our deficit or our debt?
I commit to working with you to make certain that that happens.
Will you commit, as a member of the Tea Party, that no replacement for this dreadful Obamacare that allegedly created this deficit and debt will add to the deficit and debt? Will you commit to that? Can't you tell the Tea Party you're not going to increase the deficit by repealing the Affordable Care Act?
There are a lot of contributions to the debt and to the deficit,
Well,
as you know, Senator.
That's true, and you and I talked about that briefly.
Right.
Are you going to allow the repeal of the health care bill to be one of those contributors to our deficit and to our debt? The CBO has said that repeal of the health care law could increase our deficit by up to $353 billion. That's what they've said. Senator Paul, an honest man, has gone to the floor and said, the first thing we're doing is passing a budget that increases it by $10 billion. What do you say to the Tea Party about that?
What I say to the congressional...
Or more important, people that live in Colorado.
What do I say to folks in Colorado and across this land, that the Congressional Budget Office and the conclusions that they reached on that are in a silo. They're looking at it as if nothing else happened following the repeal of the Affordable Care Act. And so if you look at the whole constellation of things that will occur, I believe, in working with every member of Congress, should I be given the privilege of serving as the Secretary, we will make certain that it addresses the health care challenges that exist out there that are very, very real, and we look forward to working with you and committing to work with you on being as fiscally responsible as we can possibly be, because the debt and the deficit is a real challenge.
With respect, and I have a lot for you, with respect, that's what every politician says about the CBO. It says the numbers aren't true, and then we just run up the debt and run up the debt and run up the debt. And almost the entire theory of the case here, I think, from the Republican Party on this subject has been that the health care law has increased costs, that the health care law has increased our deficit, increased our debt, and I would hope that you could take a pledge today that would say that nothing that you would advocate for would pass or have the President sign into law, the President-elect sign into law, would add $1 to our deficit or our debt.
Well, I certainly hope that's the case, and again, look forward to working with you to ensure that it is.
Thank you, Mr. Chairman. I yield back my time.
Thanks, Senator Bennett. Senator Collins.
Thank you, Mr. Chairman. Dr. Price, welcome.
Thank you.
I, too, very much enjoyed our discussion on a wide range of healthcare issues in my office. Many of us have expressed concern about what would happen to the millions of Americans who are in the individual market of the ACA on the exchanges. But there has been remarkably little debate on what would happen if Congress took no action with regard to the individual market. Could you give us your answer as far as what you would see happening to the individual market if we do nothing?
Well, I appreciate that, and I appreciate the opportunity to come visit you. We had a wonderful conversation about many, many different areas. The American people know this. They appreciate that the individual small group market, where many of the millions, as the chairman pointed out, gain their coverage, is breaking in many, many ways. We're in a downward spiral on being able to provide individuals any opportunity at all. So 1/3 of the counties in this nation have just one insurance provider. There are 5 states that have only one insurance provider. The premiums are going up for folks, the deductibles. I get calls almost weekly from my former fellow physicians who tell me that their patients are making decisions about not getting the kind of care that they need because they can't afford the deductible. If you're an individual out there making $30,000, $40,000, $50,000 a year, and your deductible is now $6,000 or $12,000 for a family, which is not unusual on the exchange, you may have an insurance card. It may have a wonderful name of an insurance company on there, but you don't have any care because you can't afford the deductible. And so people are denying themselves the kind of care that they need, and those are the things that we ought to be addressing. And again, I hope that in a bipartisan way we'll be able to do that.
Thank you. I think that's a very important point to clarify, that in the individual market, we're seeing double-digit increases in premiums, higher deductibles, larger co-pays, and we're also seeing far fewer choices as more and more insurers give up and flee the market. The co-ops have failed dramatically. All 23 of them are in financial trouble. Only 5 are still operating. So for us to say that everything is going well with Obamacare is just not accurate. And that's why I feel that we do need to fix the flaws of what is a well-intentioned but deeply problematic law. I want to clarify another issue on the ACA. There's been much debate on whether we should repeal the law with no replacement. I think most people reject that idea. As you said, we don't want to pull the rug out from under people who are relying on the insurance that has been provided through the ACA. Another group has advocated repeal with a 2 or 3 year delay. I think that approach also doesn't work because It creates great anxiety for consumers, and insurers would be unable to price their policies if they don't know what the rules are going to be. It's my understanding that your goal is to quickly pass a reform package that would provide access to affordable health insurance for all Americans with more choices that we have now. Is that accurate?
Absolutely. It is vital. We oftentimes don't talk also about the 20 million folks that still don't have coverage out there. There are a lot of people that don't, and if we're responsible policymakers and administrators of policy, it's incumbent upon us to step back and say, why is that? What's going on that's making that happen for those 20 million who don't have coverage in spite of all of these grand things that were done? I would suggest that it's because the structure of what was done actually makes it virtually impossible for many individuals to gain that kind of coverage. We, on the other hand, I believe it's important that we work together to put forward a system that actually allows, again, every single American to have the opportunity to purchase the kind of coverage that they think is best for themselves and for their families.
So your goal is actually to have more people,
yes,
thank you, covered by insurance. I have been baffled over the years by what CMS reimburses for and what it fails to reimburse for. Senator Jeanne Shaheen and I finally scored a victory of getting CMS to cover continuous glucose monitors for individuals with diabetes that have been covered by the vast majority of private insurers. But when those individuals aged into Medicare, they lost that coverage. Made no sense whatsoever. What I'm finding now is that CMS frequently does not pay for services that helps to keep people well. There is a large practice in my state that has a nurse or a medical assistant call individuals with diabetes once a week and check on their blood sugar levels, their adherence to their diets and exercise regimes. And it's had really positive results. Well, the irony is that if diabetes gets out of control and those individuals end up having to have amputations or go blind, CMS, Medicare will pay for that, but it won't pay for that phone call to check on the individual that's helping to control their diabetes and keep them well. Will you pledge to take a look at those kinds of policies and reevaluate what we do pay for?
Absolutely. It's imperative that we're constantly looking and determining whether or not we're getting the outcomes that we want, and the processes are either helping or obstructing those outcomes.
And finally, I want to touch on biomedical research, which is a passion of mine. I founded both the Diabetes Caucus in 1997, and I also am the founder of the Alzheimer's Task Force in the Senate, which Senator Warner is the co-chair of. Alzheimer's has become our nation's most expensive disease. It costs society $263 billion a year. $150 billion of that comes from Medicare and Medicaid. It's going to bankrupt those programs. It's devastating to families and the victims of that disease. Diabetes consumes 1 out of 3 Medicare dollars. If we invest in biomedical research, we have the possibility of not only improving lives for Americans and curing or coming up with effective treatments for devastating diseases, but also actually lowering healthcare costs. Do you support the increases for NIH that we have passed in the last year and are on track to pass this year as well?
Yeah, NIH is a treasure for our country, and the kinds of things that we should be doing to find cures for those diseases. One of the core avenues to be able to make that happen is through NIH, and I supported the increase.
Thank you. That goes along with your principle of innovation.
Absolutely.
Thank you.
Thank you.
Mr. Chairman.
We've been at this for about 2 hours. I'm going to suspend the operation for about 5 minutes, and then we'll go to Senator Whitehouse, just so we can take a little break. Committee's recessed for 5 minutes.